But
did they push you more towards math and science?
Well, see, today, you know, I look at it now, and today I would be STEM, which is, what is it, science, technology, engineering, and mathematics. I would be STEM. The 10th grade, I tested out of high school to go to early interest in college, but I had a sister and brother in college, and we just couldn't afford it even with that. So, and I'm so happy with that because I went to college and was really doing well, and I was playing my horn, which I really loved to do. And one night in freshman year, I was playing. Oh, I had a brother who was at that time, I guess Robert was a senior, and he heard me playing. He said, "Well, you sounded pretty good." I said, "Well, I've been working on it." And he said,
"From your brother, that's pretty good to hear."
And so he said, "Well, you know, you're not going to have any trouble getting a job back home." And I said, "Okay." He said, "Yeah, because there's several band directors that are retiring." I said, And my goal was to be a studio musician. That's what I wanted to do. I'd love to teach, but a studio musician, you work in, you know, it was in the old days, people before your time, Arthur Murray and all the people who had television, and not just right at the beginning of television through black and white, had studio musicians, and they were really good, and they could play, but then if you did that, you had a steady job, plus you could do gigs on weekends, and you could do travel, I wanted that, and he said, and I said to myself, "But I don't think I want to be a high school band director." He said, "Boy, you could do, it would really be good." I said, "No." I said, "No, I think I'd like to do that." I said, but I wasn't at a conservatory, so I didn't think that would work out as well. He said, "Well, have you ever thought of anything else?" I said, "No, I put a lot into this music," but he said, "Well, you like challenges." I said, "Yeah." He said, "Have you ever thought of medicine?" I said, "No, absolutely not."
Hadn't even crossed your mind.
Had never crossed my mind, ever. Of the things, I respected doctors. I thought they were pretty good, but I remember my freshman year, they have a quote-unquote a freshman award for the highest scholastic honor, and I'd gotten it, and all of the pre-med majors are just all been out of shape, you know, because they were the smartest guys. And so I really thought, you know, then nerd would be a term now with slide rule jockeys and all kinds of other I mean, you didn't want to have anything to do with them one way or the other. And so I didn't think much of the pre-med majors, and, you know, I never thought of medicine at all. He said, "Well, why don't you think about it?" And I said, "Well, I'll think about it." And so I remember reading about the people at the Mass General and, you know, what they were doing and so forth and so on. They said, "Well, you know, that could be sort of creative. I think I could get into that. But it would be just a pain in the butt to get out of music and go into medicine. I mean, that just doesn't work very well because I had so many credits. And so I went to professor of music, and of course he said, "This is the worst thing you could ever do." Plus he was going to lose a fairly good musician and scholar, and he didn't want that in his department. So he said, "I think you really would be making mistakes, so I'm not going to approve a transfer." And I said, "Well, that takes care of that." And then I realized that to go through biology would take me maybe another 4 years because of it. So I found out there are two disciplines that have a beginning. Nobody knows what the end is. And one is economics, and I'm still not sure of it. And the other was physics. And each one of those, a professor makes the decision when you've had enough or when you've done this or whatever. And so I went into physics. And in that I could languish. And well, what I needed was the prerequisites to apply for the MedCat, the Medical College Aptitude Test. So I went into physics, and the professor then said, "Well, sure." Says, "I don't know what you're going to do." And I said, "I don't want you to know what I'm going to do." And they let me do that. And the thing about it is, when I went in, I had all of these courses, and they were 3-hour courses. Well, all of the science courses were 5-hour courses. So, well, I just did it, and did fairly well with that. And so then I got to take the MedCat. And that was an interesting experience because they were trying to find a new doctor, because the doctors were, just as I was telling you about the kids, I didn't like at all. I mean, their personalities, their dad or their granddad or somebody was a doctor, and they're going to be a doctor, and they just sort of, and it just attitude. They weren't people, and so forth. So the testing system, people sometimes don't realize the test is trying to get as much out of you as you're trying to get out of that. So they were changing the test for the medical college aptitude test. So they were implementing and integrating other areas and issues. And for my year, they implemented and integrated a fine arts section. And so that was like a fox in a hen house. So needless to say, I did.
Fit you like a glove.
I did fairly well with that. And so I got accepted into medical school, and then my mother, who had 2 kids, my brother had graduated the year before, and she wanted the kids, so then I had to figure out how to graduate. And so I just got lucky. They said, well, you've gotten accepted. So there were heavy science courses and all of the 3, and so I had enough credits to graduate, and so I graduated. The truth of the matter is that was sort of for her. I could have gotten a degree in absentia if you finish your first year. That was good, but that was the beginning of other issues. I went to medical school at Meharry Medical School. It's a predominantly black medical school in Nashville, and was doing very well. My mother was a nurse in Memphis, and one of the black surgeons there was the president of the NAACP. And it was 1960, and they were protesting all over the country to integrate, allow admission to majority schools. And so he asked her, what about your son? She said, well, he's in medical school. And she said, well, he said, well, we know what he is, but do you think we could use his scores, because the university said we don't have anyone with qualifications who can pass the exam to get into our medical school. And once we find that person, we'll be happy to do it. So asked if she could use my scores, and she just said, well, yeah, he's in medical school now, so it won't matter one way or the other. And so they did, and then came back and said, well, we have found a person qualified, but he's in medical school now, so it's a non-issue. And we started thinking. I mean, the tuition at the University of Tennessee was the same as the tuition at Tennessee State. And Meharry is a private medical school, and we'd already mortgaged the house, and there are all kinds of debts going on. So she said, what do you think? I said, well, you know, I'm still playing pretty good, and if this doesn't work, I mean, that's always music, my first love anyway. She said, well, you know, it's sort of your decision, whatever you think. But if you'd like to do it, maybe you can transfer. I said, well, I think I can do it. She said, well, think about it. So I went to the dean of the College of Medicine at Meharry, and he said, son, you shouldn't do this. It's the worst thing you could do. I said, okay. How would
We'd heard that before.
But his was different, and to tell, I think I may have been 19 or something at that time, to tell a person, it's pretty different. He said, look, first of all, they don't want you to come to the University of Tennessee. Number one, that would be against you. He said, now, if you go, you're the number 2 in our class. If you go, then we're going to lose a good physician of what you could be in life. And so the community would lose that on. And I said, okay. He said, however, the problem problem may be more that if you're successful and the domino effect will take place, then for predominantly black medical school, your private medical school is very expensive, we depend on such and such, it could have detrimental effects, and so rather than losing one doctor, you could be responsible for losing many doctors. And I said, it's a little heavy. so I got through that and went for the interview, and then it was amazing. Went to Tennessee, and the dean says, "Son, my daddy was alive today. He would be so upset with me even interviewing. As a matter of fact, he turned over in his grave to know that I'm interviewing you to even consider company here." And I said, "Okay." And then went to the provost. The provost says, "It's fine." He was from, it's north of the Mason-Dixon line. He said, you passed the test. You can come, but you're going to flunk because we don't really think you're capable of handling this." And I said, "Okay." So I put all that together as a matter of when do we start. And it said, "Well, you're in the second quarter at Meharry." I said, "Yeah." He said, "Well, we don't accept Meharry as an accredited medical school." I put all that together as a matter of when do we start. And it said, "So all the work you've done there,
wow,
none of it is transferable." I said, "Okay." But Tennessee has an interesting system, at least they did then, where it was on a quarter system. It was based on World War II to promote doctors, so you could go on an accelerated program where each quarter is taught every quarter of the year. So a person can come. There are a lot of professional athletes who went to the University of Tennessee because they could do their season and then come back and hit in. The only thing, there has to be continuity, I think, during your senior year and the clinical year, so you could go through and come in and out. And I said, "Well, okay." And so I was not allowed to transfer, but I was admitted. And so then I went home and then it became even more interesting. And doing fairly well my first 2 quarters, I wasn't admitted to the dean's list, and the reason was because I had some of the material. And as a result of that, it would be unfair for the students.
Oh, my.
I said, okay.
Can't win.
After that, it went okay. It was it's an interesting situation of going there, and but it worked. It worked.
Did you finish school there? Did you go in the military?
Oh no, I finished school there. I went into at that time they had something called a senior medical student program, and you could join that. So in your senior year, you'd be paid officers' pay, incident pay. And so I did that. Now they have a thing called a health professional scholarship student, where you can join the day you're admitted to medical school, and they pay your full rank and everything. It wasn't like that then, but I did that and enjoyed it. I enjoyed military. I enjoyed the structure of it. I remember doing I told you about the continuity of the medical school. There was only one time that you had to break the cycle, and that was what's called 6X. After 6 quarters, you had to take the state medical board. So you had 3 months off to prepare for that. And so I went on active duty at Bethesda, and it was a Cuban Missile Crisis. It was 1962. And it was good in that they stopped the emergency surgeries and did only elective because they had to put the blood on all of the medical field teams and so forth. And so I got to do a lot of clinical stuff there, and then graduated. I knew where I was going when I graduated. Doing my internship, there was a Tonkin Gulf Resolution, 64 and 65. So I knew I was headed to Southeast Asia. So in July, I headed for Southeast Asia to Alameda through California, and picked up a ship and spent a year in Southeast Asia, and then came back and was going to go to the Orthopedic Hospital in Los Angeles. And my former chief, they'd had a resident to drop out, And he said, if you're interested, we'd really like to have you back. And I said, well, let me think about it. And my family wasn't really, they'd been in Los Angeles for a year that I was in Southeast Asia. And then this was about 3 months after I'd gotten back, and they thought LA was not a bad place to be. We'd had some winters in Boston, plus there'd been some social political issues in Boston, and everybody wasn't on board. So anyway, me and the family decided to go back, so we went back. I went back, there would have been 66, and then transferred my chief, who was the guy responsible for getting me back there, was also responsible for me entering the Harvard program. And so then I went into the combined Harvard with and did fellowships there in pediatrics and in spine surgery. And
is that when you started pediatrics?
Yeah. Before that, the medical school student doesn't know whether they want to cut to cure or to medicate to cure. And my experience in Southeast Asia, I felt it definitely. And I found out I don't do well with sick people. And, to that own self be true. You got to know who you are and what you are. But getting people better, and that's what orthopedic does. It fixes a joint here, it fixes a wet and an active person. And I was all into total hip replacements, and I did what's called an O-frame fellowship. It was the top fellowship in the country in '68. And then I thought about, one joint, although you could be extremely wealthy doing it, one joint, I thought I had more going. Then I went on my children's rotation and fell in love with children. And from that point, it was easy. So I got a pediatric orthopedist and other women.
How did you move into being a spine specialist?
Oh, well, pediatrics and spine, at that time, there was no such thing as a pediatric orthopedist per se. I went out to the Navy and established the first academic program in the military. And the 11th Naval District, the San Diego District was the largest in the country. And so if your child had a problem and you were in the military at that time west of the Mississippi, I could get you assigned there so that we could take care of the problem. And got involved with the spine, did a lot of spine work, but was still a general pediatric orthopedist. And finally got a job in Cincinnati, and it came, and I sort of languished here there was 6 years I was the only full-time pediatric orthopedist at Cincinnati Children's.
How did you come to Cincinnati? Did you search for that? Did they find you?
I'd done what's called a Carlberg Traveling Fellowship and had gone out to the Alfred I. DuPont Institute, and that's in Wilmington, and did research. I was going to stay in the military forever, but the families were transient, so I couldn't do credible research under those conditions. And the best database was in Wilmington, so I went there. And I was there, and so people who would come into the States from Europe or for the big meetings here, they'd come through there, and the chief said, well, there are people here, and I think that you got something going here. I said, well, what do you think? He said, well, they want to know why you're in the military. I said, So I said, well, I really loved the military and was doing
well. You were in for many years, too.
Yeah, at that time, I had, not only was I in for those number of years, but for paying my way through the Boston experience, I had a 2-for-1 payback. So I was indebted for many, many years. And so military intelligence stepped in. They came through with what's called the all-volunteer forces. So even though I had at that time maybe 16 years, as of that year, all contracts were null and void. So I didn't owe anything, but a person who would have been a year ahead of me owed all of the time that they'd been indebted for. But I got this position at San Diego and loved it, and they gave what's called a VIP, which is a variable incentive plan. And being the only orthopedist, pediatric orthopedist, and having that population group, I wanted that and agreed to it. So that's when I had to make a decision. However, I found out that an institution is whatever their commanding officer is.
Good.
And this was right at the ending of the, I'd set it up so we had a fully segregated pediatric shop. And they never had one of those in the military, meaning that it was a children's service. And that's what we did. We operated children. Well, before me, you'd go down the hallway in the clinic, and there would be active duty one side, and then dependents and retired on the other side. And that was it, where we had a pediatric orthopedic service. And so the new CO that came in, he said, service to the fleet. And he could make that decision. So whatever my thing was, that was not the most popular. And I found out it could change that way. And if I got out and got a job. But then deciding to get a job, where to go. In Boston, I won the Outstanding Resident Award, just a lot of things, and I thought it would be easy, but this was 75, and there was no center in the country who was ready to have a person who looked like me as the chief of orthopedics at a pediatric hospital. And so I said, I had a friend who was at Henry Ford Hospital. The two, I narrowed it down to where I wanted to go to was Stanford, which was really good. And there was a California coast I'd still be out there. And the other was with this fellow, Dennis Lyon, who was a very good friend. He had been what's called a buried planner on active duty in the Boston area when I was there. So I got to meet him. He said, Johns Hopkins graduate. We knew each other real well. And he said, well, why don't you come work with me? And so I said, yeah, but Henry Ford, I don't know. He said, well, that's really good. I said, okay. And so I looked at Stanford. Stanford is an interesting university, but at that time, in order to live in Palo Alto, you needed a trust fund. Stanford was an unbelievable school, but they expected you to have the money rather than them paying you. Mm-hmm. And I just said, well, let's see what Detroit. Went to Henry Ford. Henry Ford was unbelievable. When I went there, the Ford family, in honor of the father, was going to contribute $100 million to the institution if it could be matched. And they were to match it. So when I started, there was $300 million for research and development. And if you had a research project, it had to be able to provide a profit within 7 years. I said, I think I could do this. And was there and really got involved in it. And then 2 years after I was there, the fellow Ed Miller is here in Cincinnati. He was the chief here. He gave me a call and said, would you be interested in coming to Cincinnati? And I heard nothing in Cincinnati, and the answer was no way. Except I'd be chief of a pediatric hospital. And had never been an in-house chief. And so that was a challenge. And I said, I think I'd like to do that. And he brought me here. And
what year was that?
How's that?
What year did you come
1977. As a matter of fact, I have an anniversary this year.
Yes, you do.
Absolutely.
Congratulations.
Yes. So anyway, I came and started, and I couldn't get anyone to come to work with me. And it was needless to say a little difficult. So I was there for the first 7 years by myself as a full-time attending. And then finally got a fellow from the Navy that I'd known as an intern. When I made one of my visits to the Navy, he came and we started a process and so forth. We were very academic and got a lot accomplished. And so that as I hired more people, the spine is the most complex part of the service. And more were electing other parts of it, and so I got sort of backed into the spine and loved it because it was challenging. It was always complex, and I took to it. And so then I made efforts in terms of meetings and further education to get involved in the spine. And that became my journey. You know, spine is a tricky thing. There's the adult spine, there's low back pain and so forth and so on. And that has its limitations. But I did what's called adolescent idiopathic scoliosis. That's usually on young girls, 12 to 15-year-old girls. And what a spine surgeon knows is that on any given day when you straighten the scoliosis out, the spinal cord blood supply may not be ready to be straight if it's been crooked for years and it's been
I remember
in
you
place.
talking about that.
And so you can get an unbelievable radiographic result of a very crooked spine, straight as an arrow, however, nothing functions below the waist.
Let's talk about some of the really interesting, unusual cases. There's one I saw where a child's neck was in a hairpin curve. Is that a particular...
Were you looking at that?
I was.
No,
Is that a genetic situation?
Yes. What my fellowship at the DuPont Institute, my project was a condition called neurofibromatosis. At one time, it was felt to be the elephant man, and that was my research issue. And the fellow Dean McEwen there had assigned it to me. So
how rare is that?
It is 1 in 4 or 5,000. It's unusual. There's a strong genetic link, but it's an unusual condition to have. But they can have very, very, very severe. As a matter of fact, the case you saw, I didn't know you were looking, but the case that you saw, we've reported it. It's in the Journal of Bone and Joint Surgery. It is the first case that I've ever seen where the spine is completely bent over forward past its other member of the cervical spine, which means by default it's greater than 180 degrees.
Was that child functional?
Do you know what? The short answer is yes. The mother came to me. It's amazing. They were from Hawaii, and they got permission. They were seen by the shrine there, and they said, well, no. They said, well, at that point, I think I've written more about neurofibromatosis than anyone else about it in the spine, so we get patients regarding that. And they gave them permission to come to the States, that they could either go to Cincinnati or to St. Louis. The St. Washington University has an unbelievable spine service there. And so those were the two, and the mom came to me. And it's amazing, she came to me because, not knowing anything about the deformity and all that, simply because her child couldn't pull his chin off of his clavicle. He was down like that and he couldn't pull his head back. And that's what she was concerned about. No, he was completely normal in terms of function
so
and so forth.
At that point there had been no x-rays to see what his neck
At that point, no, that's when the x-ray started at the shrine out there, and that was the oh my God x-ray, because nobody considered that because, well, they knew he had this condition, but it hadn't caused him any problems, but he had a spine that was that deformed. And there's a condition called dural where there is an enlargement of the fluid sac of the spine, and it erodes the bodies. So it allows the spinal cord to sort of float about. So you can have a tremendous deformity and the patient be neurologically intact. The problem is that the patient can be neurologically intact prior to surgery. And that's where there are potential issues. And I've taught all of my residents and fellows, the real issue is that if you're going to undertake something like that, and a patient walks into your office to see you, it's important that whatever your strategies are, you really like for that patient to walk out of your office. And if you can't figure that out, then it's time to refer it. And
it's a lot more than straightening bones.
There's much, much more to it than that. No. That was an interesting case. We published that case, one, because of the deformity, we were pretty much able to straighten it out. But in addition to that, right at the crook of the spine and the spinal cord, there was a grade 2 astrocytoma, which is a tumor. So that just sort of increased the difficulty a little bit. But no, we did that. And you're pretty good at it. Yeah, I didn't discuss it.
Are you in touch with that patient?
Yes, Joe. Well, I can't mention his name. Yeah, the mother, because they see the docs at the shrine there, and they send reports and so forth. And we've had one of our nurse practitioners who they vacationed out there each year, and they'll go and see them and send X-rays and so forth. And he's done fairly well. The problem is that this thing called dermatitis that starts to go, we can't do anything about that, and it can erode the vertebral body. So everyone is aware of that and watching it. So there'll have to be reinforcements of that at some point in the future. And
how would you describe in a layman's term what has happened there in that kind of, you call it a neuro?
It's neurofibromatosis, and what you do is that there are ligaments that hold things into place. And so what this expanding tube, the dura, I use the term dura. The dura is a sac
like
that the spinal cord is in. But for whatever reason, it starts to expand, and the pressure from it can be such a very, very, very slow. That's why there are good adaptations to it, because it grows very slowly and can expand to the point of destabilizing the bone. And that's when, so the bone is not stable. That's why it could bend over and so forth like that, and be perfectly, in terms of the child's function, be innocuous to the child. Doesn't hurt, and he wasn't aware of it. It was the only thing that is told his mom, and he was always down like this, and she wanted to know why, and it was because he couldn't bring his head back.
Wow.
Yeah. That was an exciting case. We presented that, and we had plenty of referrals as a result of that. It was
You've done some multi-generational surgeries.
Yeah, you can be in a place for a long time, especially if you deal with, and we talked about the back, and some of them can be on a genetic basis, and so there's hereditary. And so I think I first started looking at it in 2007. I think I'd done maybe 4 or 5.
That's a benefit of being in the same hospital.
Yes, and that has to do. There was only one other fellow who could challenge me with time in one institution, Ignacio Poncetti. He's become known for the Poncetti procedure for clubfoot. And he had been there for many, many years. He died within the last 3 or 4 years, but at 96. And I think he may have been in clinic that week. I don't know. But I think about Poncetti, and I think about debate, and he said, I can go back to clinic tomorrow. So, but anyway. But no, and in 2007 I realized I was presenting at a meeting, and I had operated that summer kids whose mothers I'd operated on about 20 years ago. And so then we started taking a look at it. And so up to 2016, I think I had maybe 11 that I'd operated, the mother and the daughter. And usually 18 to 20 years apart. And that's a good feeling. One, if you get a good result, it feels even better, but it shows that the family unit had the confidence in you at that time, and feels that even with technology, change it to come back. And then about 2 years ago, I hit the trifecta. And that was it. I'd done the grandmother, the mother, and then the daughter.
Wow.
That was good. Yeah.
So I saw the story of the woman who became a nurse that you had operated on her as an adolescent.
Yeah.
Is that right?
Yeah.
Is she a nurse here?
She was a nurse here, and then she went and got her master's at Xavier and taught there for a while. Her husband's a physician, and she's a lady of the community now. But anyway, but I get her. She is on call for me. You know, if you're 14, let's say you're 13, and this doctor's telling you, one, they're going to put this rod in your back, and tells your mother and you, and you over here that there's been cases of paraplegia and, illness, and say, hey, and plus your dad passed out. And you say, I don't know about this scoliosis thing, and I don't know. Can we just keep the brace on? I promise I'll wear it. You know, usually they're coming back because they've been a brace for a year, and they had it on in the office visit, but that was about it. So it didn't. And as I used to tell the girls, that it only works on your back. And they said, well, I'll wear it to sleep. Oh, it works on your back. And 24. But anyway, they feel, you know, you have to be a 12 to 14-year-old girl to feel how they feel. And it was so good. And she's worked with me for years and years through the time she was 12. And it's Angie was my nurse. And then she became the spine center coordinator. And she would come in and talk to them. And, you know, you're 12 to 14, and you see this woman, you say, oh, my God. She's alive. She's gone to college. She's a nurse. She's walking. Maybe. And she talks and is really good. And they, you know, and women being women, you know, I talk to them and then I leave Angie there and so forth. And then because I'm going to come back, I have to do a lot of things, computer. And she always tells me, she said, you know what happened when you left the road? I said, I know now.
You already know.
Yeah, I know now. And that is the person, can I see your scar? And so she showed the scar, and that was it. So, no.
Has it changed a lot?
It has changed a tremendous, oh my God, you don't have time for that. No, I started with cast corrections, and you could be in a cast for 6 to 9 months to get the bone to heal. And then there was the Harrington rod, which was a jack in the back, and that was responsible for a few neurological things. And it's come up through segment, and it's come up to now what's called pedicle screws. And we put screws in each vertebra and attach a rod to it. Now it's very, very, very sophisticated, very, very mechanical. We can get it so that the accuracy is good.
Flexion and extension allowed?
Can't do that. Can't do that. No, you can't have it all. You can have a crooked spine that's flexible, or you can have a straight spine that's fairly stiff. And there are consequences to that also. But in terms of the time, you know, it could take 8-10 hours or whatever. Now it's about 3.5.
Really?
Oh, yes. And you're up in the... Also, you get up that night. You've got your IV and you get up and walk around the bed the night of the surgery. Hell, you could be down 10 days or 2 weeks when I started in this business. Oh, it has just been unbelievable. And you know, it's been a short time because it was like in the 60s when they started putting the rods in. Mm-hmm. So it's been through my career that I've seen all of these changes and being involved in the research.
Fascinating to watch it change.
Oh, my goodness. And then the other thing from the scoliosis, everybody still thinks there's a Harrington rod. They hear the Harrington rod, that's what the girl had. The Scoliosis Research Society has as its top award the Harrington Lecture. Mm-hmm. And I was fortunate to deliver that in 2012 and just went through through my lifetime of what scoliosis and how it's come about in correction. The safety of it with craniosacral evoked potential monitoring, of having instantaneous analysis of what's going on with the spinal cord while you're doing it, rather than having them to wake up in the recovery room or whatever and not be able to move it. No, it's just, it's not even the same specialty.
How does it compare to a fusion? Are the discs intact in a scoliosis?
Yeah, here's the thing about it. We mentioned that just a bit. As I said, you can't have it all. And meaning this, to fix it, you got to fuse it. We even tried dynamic stabilization, but the biomechanics are, if you've got something that's moving and it's fixed to something, something's going to give. Mm-hmm. And that veer could be the implant, could be the whatever. So the real issue that we're not able to work on, but it would be good to be able to work on it, would be the ability to offload in some ways. If you've got a column that's mobile and it's a certain length and you compromise, say, 70-75% of it, then those discs down below pay an extra load. The real issue that we're not able to work on, but it would be good to be able to work on it, would be the ability to offload in some ways. If you've got a column that's mobile and it's a certain length and you compromise, say, 70-75% of it, then those discs down below pay an extra load. And in normal humanoids, the lower lumbosacral disc, the disc, and you'll hear people, your friends, etc., will come back and say, well, you said it's an L5 S1 or L4 disc down at the bottom there. And that's when you have the flexibility of the rest of the spine. So imagine that where you've got this long pole that's that's loading into the lower spine there. And having said that, I just had, and this is the genetics of it, a father who operated on in about 1985-86, who's a urologist out in Kentucky. His daughter and his son came in. His was severe enough that we had to do it. And he was a boy state, when years ago they used to have, what did they call them? It was like the Mr. Football and Mr. Basketball and Mr. Swim, who were the state champions. Mm-hmm. And he won the state championship in swimming with what's called a T4 to L4 that I fused from the upper thoracic.
That's a long.
And he showed, I saw those videos of him doing, flip turns at the end, and it just didn't make
sense.
Anyway, but he went on. He was really good. He was one of these swimmers that back in the day. He was with the Marlins, and the family moved. The dad became a hospital administrator in Houston, and he actually stayed, I think, the 11th and 12th grade because of the Marlins. They were, that was an Olympic feat. And so he got a scholarship to Texas, which is one of the top swimming schools in the country. And in addition to that, he had a brain. And he went to medical school, and he went into urology, and he's a urologist out just east of Ohio in northern Kentucky.